This was a randomized phase 2 open-label study of Nivolumab plus standard dose Bevacizumab versus Nivolumab plus low-dose Bevacizumab in patients with recurrent glioblastoma. So as you guys all know, Nivolumab is a PD-1, it's targeted therapy for PD-1 mediated immunosuppression, and it has shown clinical benefit among other cancers. Bevacizumab is a VEGF inhibitor, which has already been FDA approved for recurrent glioblastoma. The primary endpoint of this study was to evaluate the efficacy of Nivolumab when administered with standard and reduced dose Bevacizumab in patients who had a recurrence of their glioblastoma. So the primary objective was to check the overall survival between these two arms in this patient population. The secondary objective was to evaluate the safety and tolerability of Nivolumab in combination with Bevacizumab, and to compare the progression-free survival at 6 months of Nivolumab with the standard dose, and compare it with those who received the reduced dosing of Bevacizumab. 90 patients were enrolled in this study between May 2018 and January 2020. And like I mentioned, this study had 2 arms. Both arms received the same dose of Nivolumab, which was 250 milligrams IV every 2 weeks. And arm A received Bevacizumab at 10 milligrams per kg IV every 2 weeks. Arm B received 3 milligrams per kg IV every 2 weeks of Bevacizumab. The characteristics in both arms were similar. Age was about 60 and a half years. The median KPS was 80. We had 35 patients that were MGMT methylated and 53 that were MGMT not hypermethylated. The median overall survival was 9 months for arm A and 9.7 months for arm B. The overall survival at 1 year was 41.1% for arm A and 37.7% for arm B. The progression-free survival was 5.6 months for arm A and 4.6 months for arm B. Progression-free survival 6-month rate was 46.7% for arm A and 44.6% for arm B. So the PFS and OS rates appeared similar for Nivolumab with either standard or low-dose Bevacizumab, and compared to the historical benchmarks of Bevacizumab monotherapy. However, when we did our analysis and differentiated these patients based on age, we realized that the overall survival was better in patients who were less than 60 years of age. So with this study, we kind of concluded that there may be some benefit of giving Nivolumab to patients with recurrent glioblastoma who were less than 60 years of age.